this is Elizabeth Riley and I'll be doing my head to toe video.
Hello, hi, my name's Elizabeth. I'll be the pharmacist here today. Can I just have your name and date of birth, please?
My name is Monica Zesches and my date of birth is 7/15/1997.
Okay, thank you so much. I know that you're here for a physical exam today, so we're just going to conduct the physical exam. I'm going to pass the findings on to your provider, okay?
Okay.
Okay, I'm just going to wash my hands real quick.
Okay.
Okay, so now that we're back, I'm just going to begin by inspecting your scalp, okay? Okay, so I'll be inspecting from the frontal part of her head first. Moving on to the back. There's no discoloration or anything like that and no visible bumps. Now I'm going to go ahead and palpate the same area starting at the front of the patient's head. Are you feeling any pain? So there's no tenderness, I couldn't feel any lumps or anything like that, and no scales on the top of her head or her skin. So now I'll be moving on to inspecting the patient's eyes. I'm gonna just put my hands on your eyes, okay? I'm gonna open them. Can you look up for me? Can you look down for me? Great, so everything looked normal. There was no excessive redness or swelling of the eyes. Was there any pain at all where you were moving your hands? No? Okay. Great. So now I'm gonna move on to palpating the sinuses, starting at the frontal. Just let me know if there's any pain, okay? Frontal sinuses.
No pain.
No, we're doing the maxillary. Anything? Okay. So now I'll be going on to checking for the patient's extraocular eye movements. And then I'm gonna put the pen in front of you and you're just gonna follow the pen just with your eyes without moving your head, okay?
Okay.
Great, good job. So the patient's extraocular eye movements were intact. Now she didn't have any nystagmus or any abnormal constricting of the eyes of the pupils or anything like that. They were both equal. So now I'm gonna go ahead. I'm gonna shine the light at your eye, okay? And I will be checking for the direct constriction of the right eye, which is actually on this side. Just keep looking straight, okay? Okay, so that was normal. I'm gonna go ahead and now doing that same movement, I'm gonna check for the concentric constriction of the left eye. Okay, so both of those were equal. Now I'm gonna move on to checking the direct constriction of the left eye. Now I'll be checking for the concentric constriction of the left eye. Great, so the patient's pupils were equal and reactive to light. Now we will be doing accommodation. You're just gonna look at a point behind me and then you're gonna look at the pen, okay? Go ahead and look at the pen now. Look at a point behind me again, at the pen. Good job. And that was accommodation. Now we're gonna do convergence. I'm gonna put the pen closer to your nose and you're just gonna follow it for me, okay? Great, so again, there was no nystagmus or anything like that. Both of the pupils constricted equally. Okay, now we'll be moving on to inspecting the patient's throat. So, actually no, sorry. I'm gonna move on to actually inspecting the ears of the patient, starting with the right side. Just inspecting for any discoloration or anything like that, any abnormal discharge. Nothing seems to be going on. Now I'm moving on to the left ear. Do you feel any pain or anything? Again, there's no discoloration or abnormal discharge. So now we'll be moving on to inspecting and palpating the patient's nose. Well, actually, we already palpated the sinuses, but I'll be inspecting the patient's nose. Starting with the right side, looking at the left. The patient's nose seems to be symmetrical, and there's no redness or allergic shiners. We'll continue with inspecting the patient's external part of the mouth. And now I'm checking and inspecting for any discoloration, any abnormal or excessive dryness and stuff like that, but everything looks good. There's no bluish tint or anything like that. I'm gonna have you open your mouth for me. Okay, and I'm looking inside, making sure I don't see any cavities or any sores or anything like that. The back of her throat, also there's no erythema or any sores or stuff like that. Go ahead and say for me. Making sure that the uvula goes up and down, which everything looks normal in there. Now I'm going to be inspecting as the patient swallows to make sure that everything is all right with the thyroid. Go ahead and swallow for me. One more time. Great. Doesn't seem like there was any difficulty swallowing. Did you have trouble swallowing? Okay, now I'll be inspecting the patient's neck area. On the outside, looking on the right side and left side, there's no discoloration or any hyperpigmentation, and there's no goiter visible from the outside. I will be palpating the patient's lymph nodes. I'm going to be starting with the preauricular lymph nodes. Is there any tenderness? Just let me know if there's any tenderness throughout, okay? Checking the patient's postauricular lymph nodes. Now going in on tonsillar lymph nodes, submandibular lymph nodes, submental, and supraclavicular. So now we'll be inspecting the patient's lips and fingertips for any abnormal bluish tint, which is indicative of cyanosis. Looking at her lips, everything looks normal. There's nothing abnormal. Let me see your fingers. There's no bluish tint, so that's good. Go ahead and go like this, checking for clubbing of the fingers. Everything looks normal. Now I'm going to be checking just the patient's skin. There's no eczema or any atopy. And then now I will have you turn to this side. I will begin by first inspecting the posterior part of the patient's back. And as I'm checking, just go ahead and breathe normal for me. The patient doesn't seem to be using accessory muscles. There doesn't seem to be no barrel chest or anything like that. Okay, so now I'll be listening or auscultating the patient's breath sounds. And I'll be starting on with the diaphragm on the right side of the patient's body. So you're just gonna go ahead and take deep breaths for me with your mouth open, okay? And then just continue to do so until I tell you to stop. Go ahead and stop for me. So the patient's breath sounded normal. I didn't hear any crackles, wheezing, or rhonchi, and on both sides of the patient's lungs. And I'll be auscultating the patient's heart valve sounds with the diaphragm of the stethoscope. I will be starting on the patient's right side at the second intercostal space, at the subclavicular line, at the upper right sternal border. Again, it's the aortic valve sound. Okay, now I'm going to be moving to the pulmonic heart valve sound, which is at the second intercostal space, at the left upper sternal border. Now moving on to the tricuspid valve sound, which is at the fourth intercostal space, at the left lower sternal border. And then now lastly, I'll be doing the mitral valve sound, which is located at the fifth intercostal space. On the top, I did hear for the pulmonic and aortic as S2 is greater than S1, and for the mitral and tricuspid, S1 was greater than S2 sound. Patient had regular rate and rhythm, no murmurs, rubs, or gallops, and I didn't hear any extra sounds, S3 or S4. Now I'll be moving on to palpating the patient's pulses. I'll be starting on the right side, feeling the temporal pulse, making sure only to do one at a time. Looks good, so I'm gonna give it a +2. Now moving on to the left temporal pulse. Again, +2. Right carotid pulse. +2. Left carotid pulse. +2. I'll be moving on to the brachial pulse on the right arm. +2. Now moving on to the left brachial. +2. And I'll be doing a radial pulse on the right hand. +2. Radial left pulse. +2. Moving on to ulnar pulse of the right hand. +2. And then ulnar pulse of the left hand. +2. Now I'll be checking for edema on the feet of ankles of the patient. Starting with the feet. Moving on to the leg. There was no pitting edema on the right leg and ankle. Moving on to the left foot. Now the leg. Okay, there was no pitting edema on the left foot either. Okay, so I'm gonna begin by washing my hands from assessing any edema on the patient's feet. And then I will begin by just inspecting the skin of the abdomen area. I don't see any abnormal discoloration or abnormal contour. Also no notable scars or striae. No yellowing of the skin, no spider angiomas or ascites or anything like that, so everything looks normal upon inspection. Now we'll begin by auscultating for the patient's bell sounds. Starting with the right lower quadrant. Moving on to the right upper quadrant. Left upper quadrant. And left lower quadrant. The patient did have normal active bell sounds in all of the 4 quadrants. Now I will begin by palpating all 4 quadrants of the patient's abdomen. Let me know if there's any pain or tenderness, okay? I'm going about 1 centimeter down. That was the right lower quadrant, right upper quadrant, everything's okay? Left upper quadrant, left lower quadrant. Okay, great. So everything was good with the abdominal exam. I'm gonna go ahead and wash my hands real quick. Okay. All right, ma'am, I wrote down everything and I'll be providing everything to your prescriber, okay?
Okay.
Thank you so much.